Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our weekly news conference for the latest in COVID-19 information. Let me go ahead and introduce who is on our panel today. We are joined by Casie Stoughton, Public Health Director for the City of Amarillo, Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center, Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamanteer, Chief Medical Officer for BSA, and Dr. Rodney Gonzalez, Director of the Amarillo VA. What we'll do is we'll open it up to our individual panel members for statements, and then we will take questions from our local media members. Let's go ahead and start today with Casie Stoughton. Casie, how are you this morning?
I'm good, thank you, Dave. As we're moving into this first week of August, I want to say hello and thank you to all of our teachers who are getting ready to go back to school. I know there's been a lot of planning on behalf of the school districts, and so thank you those teachers who are getting ready to go back to teach our kiddos. So our thoughts and prayers are with you as you're going back to schools this week. So we'll move into our update now with our numbers. As of yesterday, there were a total of 5,217 cases of COVID-19 in Potter and Randall counties, 3,571 cases in Potter County, and 1,646 cases in Randall County. We have a total of 4,355 recoveries and 66 deaths to report for our community. That leaves us with 796 active cases currently. Each of the cases do represent a unique individual. The Public Health Department drive-through testing site does remain operational. Please call Amarillo Public Health hotline at 378-6300, and our call takers will screen and direct you to the testing site. Casie Memorial Blood Center appreciates all blood donations. If you have recovered from COVID-19, please consider donating blood today. And if you've not had COVID-19, your blood is still also incredibly important. So please call Casie Memorial to schedule a donation or find the nearest mobile testing site to donate. Preventing COVID-19 remains so very important. Wearing a mask, staying 6 feet from others, staying home when you're sick, and practicing good hand washing. These efforts can slow the spread of COVID-19 in our community until there's a time when we have a vaccine. We have heard some good news in the past few weeks on the development of a vaccine. We're excited about this progress, and that means so much for our health, our community, and our economy. Vaccines are a unique opportunity to help ourselves and our loved ones. And that's all I have today, Dave.
Thank you, Casie. At this time, let's now go to Dr. Scott Milton, Public Health Authority, Texas State University Health Sciences Center. Dr. Milton, how are you this morning? Hello, Dr.
Can you hear me?
Yes, we have you now.
Okay,
How are you?
Good. Okay. Yep. Thank you. Yes, it's good to be back. And then just as Casie had mentioned, I just want to reiterate how important it is to continue to wear a mask and practice social distancing, avoid congregating. And if you're sick, please stay home and try to wash your hands. Also, just to add to Casie's statement about school, that this is the most pressing and upcoming event is the upcoming school openings. And we at the health department will continue to be in constant communication with the various school districts within our jurisdiction. We have been always involved in some of the many discussions in the planning. And there's just no doubt that this would be a challenge, but we will be here to help as much as possible and get people through this. And that's all I have to say, Dave. Thank you.
Thank you, Dr. Milton. At this time, let's now go to Dr. Brian Weis, Chief Medical Officer for Northwest Texas Hospital. Dr.
Hey,
Weis,
well, thank you. Hey, good morning from Northwest. Hey, I know we have talked a lot about the incredible job that our frontline staff are doing, the nurses at both hospitals and the clinics. I want to talk a little bit about an unsung hero, though, which is the Panhandle Regional Advisory Council, or the Panhandle RAC. Now, back in 1992, the Texas government set up 22 of these RACs around the state to coordinate mostly trauma care and emergency preparedness. And since the beginning of this viral scare in this area, the Panhandle RAC has done tireless work to support the 25 counties that they oversee in the Panhandle of Texas. And under Executive Director PJ Lemons and also Kevin Russell and the entire staff, they have helped us obtain the PPE that we need. They've also helped for all the planning and coordination for the alternative care site that we thought we might need if we got overwhelmed. And then recently, they've helped Northwest Texas obtain some traveling nurses as some of our nursing staff has gone out on quarantine because of being positive. So the Panhandle RAC has done an amazing job of supporting us, and I want to thank them personally, and I know Northwest appreciates all the efforts they've made. So let's talk a little bit about the Northwest numbers. Right now, we have 34 positives in the hospital. That continues to be a slow creep upward from July 1st, where we had about 7. We have 21 of these patients in our critical care unit, and 8 of them are currently on ventilators. I have to say that what we're doing now for any patient that is on a high oxygen need, we are doing that proning, which means we're turning them on their abdomens to help them breathe. And that's very labor intensive for our nursing staff, but we are trying to keep as many patients off the ventilators as possible because we know they do better by not being on ventilators. And right now we have 17 employees that are currently quarantined, either because of high risk exposures or being positive. Talk a little bit about remdesivir, which is the drug we've been using. Right now we have 94 vials left. That's enough to treat between 9 and 18 patients, depending on whether or not they need 10 or 5 days of treatment. Right now we have 16 patients actively being treated with remdesivir. In total, if you include those 16 patients, we have treated 74 patients in total with remdesivir. Kind of an interesting development. One of the drugs that we've been using is a drug called tocilizumab, which is a drug that's been used for arthritis. And within the last week, the company that makes that drug, Roche, announced that they had a phase 3 trial looking at this drug in patients who are hospitalized with severe COVID-19 pneumonia. And they showed no benefit in terms of these patients clinically from this drug. So that now takes out hydroxychloroquine and tocilizumab as two drugs that we thought might be promising, but now the data is telling us that they're not beneficial in patients hospitalized for COVID-19. We are continuing to use dexamethasone as well as remdesivir for our patients. In terms of testing, right now, in July, we were doing between 320 and 420 tests per week. Now, it's kind of interesting. Back in June, we were getting about a 4% positivity rate, meaning that 1 out of 25 tests were positive. When we look at July, we are now getting just above a 10% positivity rate. So that means 1 in 10 tests are positive. So clearly, we've seen that June was kind of a lull in the action, and back in July and now August, we're seeing this increased percent of positivities in the tests that we are doing. I do want to remind people we are offering antibody testing at our freestanding emergency rooms. It is a cash only, about $120 for the test, takes about 30 minutes. But I do want to remind you, as Dr. Lamanteer said last week, we don't know what to do with these results necessarily. We do not think that having antibodies guarantees that you are protected from getting COVID-19 again. The one thing it does do is allows you to donate convalescent serum if you want to do that, if you do have the antibodies. With regard to our own PPE, our personal protective equipment, we're doing very well. But it must be said that we are continuing to be very judicious about how we use it. So we're following CDC guidelines and WHO guidelines because we don't want to waste it. So we are being careful how we use it, though right now we have enough. And just finally, it's been my impression in the community that a lot more people are wearing masks. And I truly appreciate that. I think that is absolutely the right thing to do, as Dr. Milton and the mayor have said. Even more, I want to personally thank those retailers that have made it a priority to have people wear a mask in their businesses. I think it's absolutely critical, and that really helps contribute to the community. So that's all I have for this morning. Thank you.
Thank you, Dr. Weis. Let's now go to Dr. Michael Lamanteer, Chief Medical Officer for BSA. Dr. Lamanteer, how are you this morning?
I'm doing well, thank you, and good morning, everybody. Well, the report from BSA today is really pretty similar to where we were last week. We're a little bit lower in terms of our inpatient volumes today. Last week, we had 37 confirmed cases in-house when I spoke to you all, and today we're down to 30 confirmed cases in-house. So based upon what Dr. Weis said today, that looks like we have about 67 hospitalized patients with COVID. So really, this is kind of the bimodal distribution of COVID cases we've seen so far. We had that first peak in early May, and now in here mid to late July is the second peak that we're seeing. And we really haven't started to go on the downcline yet, folks. So we really need to continue to be fastidious with our practices in terms of mask wearing and social distancing to try to have this curve take a sharper course downward and hopefully reduce the number of cases that we're seeing. Of the patients that we have in house now, 16 are in the ICU. And of those 16, 7 of those are on the ventilator. We still are seeing about 20 to 30 patients a day come through our specific respiratory triage area in our ER, which is an area that we created to segregate those patients that have presumptive COVID and try to keep those folks in a separate area with separate ventilation. We currently are still dealing with fairly high volumes in our ICU. And we're attempting to closely monitor our elective surgical cases that could take up ICU beds so that we can spread them out when appropriate and when able with collaboration with our surgeons and other procedural physicians that are doing these types of elective cases. It's important that we continue with that type of activity because certainly when we say elective, it does not equate to unnecessary when we're talking about procedures, clearly. So it's very, very, we have to be very careful to make sure we're being clear about that. The next thing I'd like to say is that our testing, similar to what Dr. Weis said, we're seeing an uptick in positive tests this month. We've done over 6,700 tests since the outset of the pandemic here at BSA. And the overall positivity rate since the beginning really has been hovering in that 18% range in terms of total positives out of that large volume of testing that we've done. It's also an interesting stat, I think, to tell you that we've now admitted over 400 unique patients with COVID-19 at BSA since the outset of the pandemic. And that is a significant number of patients that have been admitted. The overwhelming majority of those patients have been discharged and have recovered. And unfortunately, some of those have not recovered and have passed away as a result of a severe COVID infection and some of the comorbidities that they have. I'd also like to point out that from a treatment standpoint, we have now reached about the mid-40s with total patients that have received remdesivir. We received that drug a little bit later than some of the other facilities across the state of Texas, but now we're getting good allocations of that medication. And although it did not show a mortality benefit, it absolutely did show a reduction in hospital stay. So we still think there is an important role for remdesivir. Dexamethasone, as Dr. Weis and Dr. Milton have also mentioned previously, is another key piece of our treatment armamentarium. And we've treated almost 200 patients now at BSA that have been admitted with dexamethasone, just as another statistic. And I totally agree with the comments made about tocilizumab. And that is another example, folks, of when we initially jump on a potential therapy with some early data, and there was early data that suggested this drug might be helpful. When additional data comes out that's better, meaning the study is a higher quality study and doesn't show benefit, we need to abandon that therapy. Otherwise, we're subjecting people to costly interventions and potentially harmful interventions that no longer are showing a benefit. So again, we're all on the same page, I think, in our medical community there in terms of how we have to move from where the best evidence lies. The last thing I think I should comment on is that we have recently, with the help of the local Department of Health officials and the CDC, we revised our return to work guidelines to be in line with CDC parameters. It's really helped us in terms of reducing the number of staff on quarantine. We're down to having really about 11 nurses now on quarantine at BSA. And again, the majority of these have been community exposures. Some of them are hospital exposures. But we also modified our masking policy at BSA, where we have elevated those folks that are not taking care of COVID patients into KN95 masks. Again, we're keeping the N95s for those taking care of COVID patients, but an attempt to try to also reduce exposures for staff that are patient-facing. Even when they're not taking care of a COVID patient, we're putting them in KN95s. And that's a conservative strategy that we're doing in an attempt to try to, again, reduce quarantines, keep as many staff as we can available to take care of patients that come to BSA for all types of illnesses. And it actually looks like it helped us prevent an exposure just this week, which we're happy about. Again, finally, I'll conclude with echoing Dr. Weis. The RAC has been a big support structure for us, just like our Amarillo Department of Health officials have been since the outset. We're very appreciative of their work. They continue to send us PPE now, which we're very happy to receive and help to protect our staff. So again, I think the teamwork in this medical community in response to this pandemic has been outstanding. And that's all I have for today.
Thank you, Dr. Lamanteer. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
Good morning. Thank you. First of all, what I'd like to report from the Amarillo VA is that currently we have 2 patients in-house with COVID positive, both of which are in the ICU, neither of which is on the ventilator. We do have 22 veterans that we are tracking that are on home self-quarantine. And then we have 1 PUI veteran that we're waiting for the test results to come back. As with the other hospitals, we are doing some elective surgeries, although we do look at them ahead of time and make sure that it is safe to do it. And as Dr. Lamanteer is, make sure that we have the services and support to handle. I would like to remind everyone the standard COVID precautions: wear your mask, good hand hygiene, practice social distancing, and if you're ill, to stay at home. And then lastly, what I just want to say is this Friday is National Purple Heart Day. And so I'd like to thank the many veterans who have earned the Purple Heart. And just as a reminder, this hospital, the VA hospital here, is named after a Purple Heart recipient, Lance Corporal Thomas E. Creek, who earned his Purple Heart during the Vietnam War, and in those actions also earned the Medal of Honor, saving the lives of other Marines while giving of his own. And so with that, I'd like to thank our staff here for what they are doing to respond to the COVID pandemic and what they are doing every day to take care of our veterans. And thank you for this opportunity to the City of Amarillo.
Thank you, Dr. Gonzalez. At this time, we're now going to go to questions from our media members. If you have a question for an individual panel member or the panel as a whole, that's perfectly fine. Let's go ahead and start with KFDA News Channel 10. I don't want to guess on which reporter it is, but it is KFDA News Channel 10 if I'm not mistaken.
Hey, Dave. Yes. My name is Vanya. Hi, everyone. Thank you so much for your time.
How are you?
I'm good. How are you?
Good, good.
Good. So my question is for either any of the doctors. Have you guys seen any patients with complications like kidney injury requiring dialysis, or liver injury, or septic shock? Any of those?
Yes, I could take that. Kidney injury is very common with COVID infection, likely has to do with the cytokine storm. And so certainly we have seen plenty of patients that become severely ill and have evidence of both kidney involvement and liver involvement. Yes.
Thank you. Also, do you guys, have you all seen any indications of the amount of asymptomatic cases that we have in the area, or like an increase or any kind of trends around that?
Well, of course, just the nature of being asymptomatic usually means that they're going to go undetected. And so by nature, it's difficult to document whether someone is asymptomatic or not. But the studies have shown that clearly that it's very common. It's probably somewhere between 20 and 40% of individuals have asymptomatic spread. It's just a very contagious virus. The majority of our testing has been concentrated on individuals who are sick and therefore are asking for testing.
Got it. And Casie, do you know if the cases are still largely spread out, or are there emerging concentrations that we're seeing?
Currently, the cases that we're seeing are still in kind of more widespread clusters as opposed to 1 or 2 large outbreaks.
Okay, thank you. And lastly, do any of y'all know or have any kind of data of how children in the area have been affected by the virus?
I don't
So
have
we
any.
have a
Go ahead, Casie.
So we certainly have we've seen a few children who have tested positive. I think that once school starts, we'll see, I think we'll have certainly more indicators on how children will be affected, because we'll be bringing larger groups of children together. And so I think, again, prevention is going to be so important as we move into later August and the September timeframe as school starts. But we have seen cases in children. Dr. Milton, did you have additional information there that you wanted to share?
Nothing specific, just that I've been in touch with pediatricians, and it does, and we have seen some cases in children.
I would just say at Northwest, we've had there's a handful of kids test positive, including some infants. As far as I know, we've only treated one non-adult with remdesivir because of the severity of their illness. So thankfully, most of these kids are getting past it pretty well, but we are seeing the positives.
Thank you. Thank you all so much for your time. Appreciate it.
Thank you. Let me go ahead and do David Gay of the Amarillo Globe News was participating. He's having technical problems. Isn't technology grand? So he texted me a question for our medical professionals as a whole. I'm just going to go ahead and read it verbatim. Casie mentioned earlier vaccines. What are the medical professionals' comments on the status of vaccines and what it can do for our community as a whole?
Mm-hmm. Want to take that, Scott, to start, or?
Yeah, I can at least start on that. There's as people can read in the media, there is a huge effort by multiple companies to develop vaccines for this, and the rapidity that they're able to potentially bring something to market is really remarkable and unprecedented. I think, that being said, there's going to be questions that will remain in terms of the durability of a vaccine, and so I think it's very important that we try to develop a vaccine, and once it goes through all the testing and FDA regulatory efforts, then I think that it will be safe. And certainly, I would be one who would suggest that we try to get that vaccine if and when it becomes available.
Yeah, I agree with Dr. Milton. I think that certainly there's different types of vaccines that look like are being pushed forward. One is a messenger RNA vaccine, and there are a couple that are on an adenovirus platform, which is just a different way that they structure the vaccines. But the only reason, I think, I agree with Dr. Milton, the only reason we have the potential rapidity to getting these into full utilization with either healthcare workers and then the large population of the general public is because of the previous two coronavirus outbreaks with SARS and MERS, where there was already some research being done on vaccine development, which then I think was the initial groundwork that allowed researchers to be where we are today. And again, hopefully sometime in the beginning of next year, we're going to have something available to start vaccinating categories of individuals that are most high risk.
I would just say in response to that, I completely agree with what Dr. Lamanteer and Dr. Milton said. A lot of very promising work, but we can't forget that we have effective vaccines for other conditions that could complicate COVID-19. So please, the important thing is get your flu vaccine this winter. For those as appropriate, we have pneumovax or pneumonia vaccines for common causes of pneumonia, because we know that COVID plus one of these other organisms can pack a very mean 1-2 punch. So protect yourself from what you can, and then we'll hope for the best with the coming COVID-19 vaccine.
Thank you, doctors. This time, let's now go to, I want to say it's Aaron Langston from KAMR Channel 4, but I don't think it's Aaron today. Good morning.
Good morning, Judd Baker with KAMR here. Thank you guys for your time today. I just wanted to hear from y'all. On right now in the Amarillo area, do you think we are in a good place for schools to be going back to in-person classes?
That question, I think I would answer it this way. I would love for us to have less generalized community spread at this point in time. I think that if we can continue to mask and continue to practice social distancing, even if school is starting in 2 or 3 weeks, I think that is going to put us in a better position. So it's not ideal where we are, but I think it is what it is, and we still have control over things. I think if we can, as I said, if we can continue to do the things that we have seemed to be more compliant with now in the community, it will make a difference.
Thank you, Dr. Milton. Any other questions from Judd?
Yes, we had one of our anchors wanted us to ask about this. We had kind of heard some talk going around that there are not enough rapid tests, or we have kind of started to run out of rapid tests in the Amarillo area. Can any of you confirm that, or are we in a good place for rapid tests right now?
I can only speak for Northwest. So we have been challenged in having enough of the rapid test. So that's the thing, is what we're having to do is be very careful about making sure that when we're going to test a patient, if we need that response immediately or test an employee, we will do the 1 hour rapid test. But for anyone else, we're going to try to send it out, and we're getting our send out test back typically in less than 48 hours right now. But the problem is it's been an inconsistent supply for us of the Cepheid test, which is the rapid test that we're able to do. So we're just having to be very judicious about who we use it for.
Yeah, and I would just say at BSA, since the outset of the pandemic, everybody's been concerned about testing kit inventory, especially for the rapid RT-PCR test, which is what we use here at BSA on that Cepheid device as well. And we are in pretty good shape right now with our inventory. Because of some of the measures that we put in place earlier in terms of some of our protocols and processes. And again, right now, we're still in a very strict protocol in terms of who gets the rapid test. Healthcare workers that we need a quick turnaround on, absolutely, in terms of establishing patterns for contact tracing and what that would mean, and safety of individuals. And then also for patients that are admitted to the hospital that are suspicious for having potentially COVID. Not all admissions, just those that we have a suspicion. We're doing the rapid testing because, again, it really is key to get those individuals in the right units, make sure staff are wearing full PPE and not partial PPE, which is being done in non-COVID units. So that's kind of where we stand right now with testing.
Okay, thank you all so much.
Thank you, Judd. This time, let's now go to Dalton Williams from KVI Channel 7. Good morning, Dalton. How are you?
Good morning. I'm great. How are y'all today?
Very good. Thank you.
Good. So this is just going to be kind of for the panel, kind of bouncing off, I believe, what Channel 4 had asked with schools. Are we concerned with possibly seeing an influx in COVID cases with going back to in-person schools?
So I can answer that one, but I think we're having a really hard time hearing Dalton, but I can take that one. I think so. I think anytime that you gather in groups, the risk of COVID-19 increases, and so knowing that just as a foundational fact, there are lots of precautions that are being taken. Dr. Milton mentioned masking, social distancing, all of those things that we've talked about for so long are so important, and especially when we're going back into school. And so, the risk certainly is increasing as we're moving into larger groups gathering together.
Okay, thank you. Did anyone else want to comment on that before I? Okay.
Any other comments from a panel on that question?
I would just agree with what Dr. Milton said and also Casie both. And obviously, anytime we get gatherings, we're increasing the risk. I don't think anybody knows what the perfect strategy is. We've got to keep the educational system moving forward for our children. We've got to have a plan in place. And again, no plan is going to be perfect. Doing the mitigation strategies as the adults in the community, and not only how we behave ourselves, but how we instruct our children in terms of complying with those masking guidelines and whatnot are going to help the whole process. And in general, there is some decreased risk for pediatric patients compared to adults, although it does not mean that we don't have pediatric patients that get severe infections because some do. And obviously we've seen that. So that's a calculated risk that we're taking as a community, and that's every community across the state and country has to make these same difficult decisions.
And I would add just understanding that we will have to be flexible as a community, knowing that there will be changes to protocols, there will be changes to the way things are delivered, the way instruction is delivered, the way, things won't always look the way we expect. And so we're all ready for flexibility.
Okay, awesome. And then for Casie, you had mentioned Coffee Memorial and the blood donations and all that. I did a story with them about a week or two ago about their convalescent plasma. Do we have any numbers of, like, are we concerned with any shortages, or are we still in the green for convalescent plasma and kind of like blood banks for all of that? Are we concerned with any shortages on just blood, period?
I'm sorry, I can't hear.
I'm sorry. I don't know if there's anything wrong with the mic that I have right now. Are we concerned with any blood shortages or convalescent plasma shortages?
He's asking about convalescent plasma shortages.
Okay, Coffee Memorial hasn't communicated any shortages to us, and we just want to use this opportunity to encourage people to work with Coffee Memorial to donate. We have, 5,000 people in our community who have had COVID-19 or have COVID-19, and so there's a lot of opportunity for convalescent plasma donation, and so we just want to encourage that type of donation, but Coffee Memorial has not communicated a shortage to us.
Okay, awesome. That's all the questions I have. Thank you all so much for your time.
Thank you, Dalton. At this time, this concludes our weekly COVID-19 news conference updates. I want to thank all of our panel members for participating in this. We do this every Wednesday at 11 a.m. Thank you to our panel members for taking the time to provide this information to the community. This is David Henry. I'm the Communications Manager for the City of Amarillo. We will see everyone next week. Thank you.
Thank you.
Thank you.
Thank you.